In this video, I will be talking about developmental assessment. It is a very important OSCE topic in case of pediatric final year examination. So we have to assess the developmental status, right? So first of all, we have to know a term which is known as developmental quotient, which is also represented as DQ. It is developmental age by chronological age. The developmental age we have to find out by asking the mother about the milestones achieved by the child, right? So by asking the mother about the milestone achieved by the child, we can assume the age. And this chronological age, it means the actual age. It is the actual age. These milestones will be according to domain, right? According to domain. So when we will call that there is a delay in development, when the DQ, that is the developmental quotient, DQ is less than 70, right? And we will call there is global developmental delay when there is delay in more than equal to 2 domain. And what are the domains of development? This we have discussed in another video. Gross motor, fine motor, language, and social, right? So these are the 4 domains. So to assess development, first of all, a child will be kept, right? A child will be kept with his or her mother. Build a rapport. So what it includes? It includes like introduction. Introduce yourself, like good morning, myself Dr. A. I'm here to ask a few questions about your child's development. Is it okay for you if I proceed? Introduction, right? Then we have to ask the questions. Now what questions we will ask? This is the questions are asked to assess the developmental age. First of all, we will start with the gross motor, right? So gross motor, we have to ask the mother about the milestones achieved. Like first of all, we have to ask whether your child can sit with support, whether your child can walk, whether your child can walk with support or without support, whether your child can run. So according to that, we have to assess the developmental age, right? Suppose the mother says that my child cannot walk, but my child can sit with support. So sit with support, which is a tripod, right? Tripod position. It is achieved at 6 months of age. So we can assume that the developmental age is 6 months, right? But my child cannot sit without support, only sit with support. So we can assume that the age of the child is 6 months. Then coming to the fine motor. Fine motor, we have to ask whether your child means reach out to object with 2 hand or 1 hand. If the mother said then my child reach out to object with 2 hand, it is by Bidextrous grasp. Reach. Bidextrous reach is at 4 months. If the mother says that it is unidextrous reach, then it is 6 months, right? Then we have to ask whether your child can hold small object, which is a mature and immature pencil. This is immature pencil grasp. Immature pencil grasp with index and thumb finger. This is mature pincer grasp. If it is achieved, then he is more than 9 months. He or she is more than 9 months of age, right? Suppose the mother says that my child cannot hold small object, but reach out to object with a single hand. That is my child is having unidextrous reach. So we assume the age to be 6 months, right? In case of language, we can ask whether your child can say ma, ba, that is monosyllable or bisyllable. Suppose the mother is saying that my child can say bisyllable but cannot say meaningful words. Cannot say meaningful words means that the age of the child is less than 18 months. That is, can't say meaningful words, right? But can say bisyllable, that is mama, baba, papa, like this. Okay, so bisyllable means age is more than 6 months, right? Okay, and the fourth one is the social milestone. Social milestone, the mother says that he has only achieved mother regard, or what is called as the social smile, which is achieved at more than 2 months of age. And the mother says that there is no other milestone achieved. There is no mother regard, there is no stranger anxiety, there is no bye-bye, and there is no pointing to object. Okay, so these are not achieved. Suppose the mother is saying that. Now then we have to ask the chronological age. Chronological age. And the mother says that my child is 18 months, right? My child is 18 months old. Now in this case we have to find the DQ, or the developmental quotient, in every domain, right? So starting with the gross motor, what will be the DQ? DQ is this developmental age at 6 months by chronological age, which is 18 months, into 100. So 3, right? Coming 3 in hand 1, 3, 33%, 33.33. So this is less than 70, right? This is less than 70. So there is a developmental delay, or we can simply say that there is a delay in this domain, delay in gross motor, delay, right? Similarly fine motor also 6 months, that is the 6 by chronological age, 18 months into 100, it is also coming as 33.33%, right? There is also delay, there is delay. In language, similarly, the developmental age, development age is 6 months, but the mother is saying the child is 18 months old, so there is also delay. And social milestone, obviously it is 2 months and the child is 18 months, obviously there is a delay. So we can clearly see that there is a delay in more than two domain, right? So this is a classic case of global developmental delay. One most important example is cerebral palsy. Okay, so this is how it is done. In my final year exam, there was a case of cerebral palsy, and the DQ was coming around 50%. So it was obviously less than 70%. So there was a delay, and there was a delay in more than three domains. The child was not. So what is preterm correction? This is measured up to 2 years of age. Suppose a child is born at 32 weeks, right? This is obviously a preterm birth. Preterm birth, right? So one important point is this is up to 2 years of age. We check for the preterm correction. We check for the preterm correction up to 2 years. Okay. So suppose a child has attended for developmental assessment and the birth was preterm birth. This is an important question to be asked to the mother, whether the child was born at term or preterm. This is an important question to be asked, right? So what is the preterm correction? Forty weeks minus actual week of gestation. Suppose this is example, okay? So 40 weeks minus 32 weeks, which is coming as 8 weeks, which is equivalent to 2 months of age, right? Suppose a child has come whose birth was at 32 weeks, okay? The child is now 3 months old. This is an important example, but there is no neck holding. Okay, so is this a case of delay? So clearly we have found out that the preterm correction is almost 2 months. That is 40 weeks is the standard we take, and we subtract gestational age, that is 32 weeks from 40 weeks, and we found out there is 2 months is the correction time. So what we do is that we subtract this 2 months from the 3 month. 3 month minus 2 month, this is 1 month is the corrected age. That is 1 month is the corrected age. So we can, the time limit for neck holding is around 3 to 4 months neck holding is completed, okay? So the corrected age is 1 month. So if the mother is complaining that there is no neck holding, so it is completely normal in this case, okay?